with a facial examination. First, from the foot end, the position of the face is very important to assess any deformity in the face or any asymmetry. If there is any asymmetry, that indicates facial palsy. And facial palsy is, then we differentiate, this is the upper motor neuron facial palsy, and this is the lower motor neuron palsy. So in case of the lower motor neuron palsy, the patient is unable to make up wrinkles on the forehead, the lower motor. So there is a loss of one side, and the others there is a Bell's phenomenon. So this patient presents with a facial puffiness. So the first start from the forehead. Assess any problem in the forehead, like any pigmentation, any loss of hair or the hair line, or there's any wrinkle in the face. ऊपर मेरे उंगली को देखिए, मेरे अंगूठे को देखिए ऊपर. So she can make a wrinkle of both sides. मुंह में हवा भरे, दांत दिखाइए, आंखें बंद कीजिए, खोलने नहीं देंगे आपने. आवाज आ रही है, इस तरह करें. So this is regarding the facial muscles assessment. So facial muscles are intact. जबान दिखाइए, पूरी बाहर, जहां इस तरह टच कीजिए, उस साइड पर कीजिए. After assessment of the facial muscles, how we will assess the reason of a puffiness. What are the possibilities of puffiness of the face? One is steroids intake. The second possibility is hypothyroidism. The third possibility is renal environment. The fourth possibility is superior vena cava. We should assess the superior vena cava assessment by a assessment of any neck vein congestion, or there is a veins, congested veins on the front of a chest. Any other possibility are facial CCF. Then the patient congestive cardiac failure can present with a puffiness of a face. Anything else? PCO. So you should simple the things in a simple order. Associated, first we should know the systemic disease, or you should know any local problems. So the local problems are like one possible, the local problem of puffiness of the face, any disease, the local disease like a parotid infection, parotid swellings, which can present with that's the puffiness of the face, the bilateral. One is the local problems, and the second thing is systemic problems. Right. So in the local problems, we should assess the parotid glands as well as any problem in the cheek, as well as there is any dental problems which can present with that's a swelling of the face. But this swelling is most of the time is asymmetrical. But there is a diffuse puffiness of the face, then we should assess the peripheral or diseases or systemic diseases. What are the vital organs which are associated with puffiness of the face? First is the heart. If there is a congestive cardiac failure, the patient may present with the puffiness of the face or generalized NSR, also NSR. The second important organ which is associated with the puffiness of the face, the kidneys. The renal nephrotic syndrome can present with this condition. Third important organ is the liver disease. Liver in the form of a hypoalbuminemia, like a chronic liver disease, which presents with the hypoalbuminemia features. The patient presents with the puffiness of the face. And the fourth,
adrenal gland, Cushing syndrome.
Yes. Thyroid, hypothyroidism. So hypothyroidism can present with this. So these are the main problems. The four problems are associated with systemic disease. So always categorize the things in a first local and then the systemic to reach a confirmed diagnosis. Then how will proceed with investigations? So first, very important is the examination of the patients. And then regarding the examination of the patient, if this is the pushing light feature phase, then we assess the surrounding area. What about this? Like a
Buffalo.
hair loss or
Buffalo.
frontal
opacity.
zoom light phase
Like this.
and
Frontal opacity.
frontal opacity and so these are the areas which are indicate the patient may suffer from the pushing disease or is stays it as a steroids. And the second thing is the hypothyroidism. About the hypothyroidism, again assess the patient regarding the thyroid glands of the pointers. If there is an enlarged or in some condition without enlargement of a thyroid, there is a puffiness of the face. Then we should assess the dryness of a skin and the dryness with the hair loss again and the dryness of the skin, and there is a non-pitting edema which indicate the patient is from the hypothyroidism. The next disease is the cardiac disease. In the cardiac disease, there is a generalized or anasarca. So there is a generalized swelling on the body. And similarly, there is a venous congestion of a neck or there is respiratory distress. The next is then the liver disease. In the liver disease, there is abdominal distension, along with there is a features of a liver disease like splenomegaly or spider nevi, and there is a palmar edema in the hands. The next is the renal system, the renal failure or the nephrotic syndrome. The nephrotic syndrome again present with the puffiness of the face. There is a typical feature of pain. Patient is anemic, or there is a swallow complexion which indicate the renal involvement. So these are the important things which helpful in making the confirmed diagnosis. Then how would you proceed with the investigations? Yes. Sports. Yes, okay. So this is a sports. This is a hypothyroidism. PT4 and the TSH is that the test of inflammatory test. The next is pushing. For the pushing, then we should assess the serum cortisol levels in the morning or in the evening time. Next investigation. For the cardiac failure.
Echo.
And the echo and the ECG, which indicate yes. For the renal failure, the EGFR is the investigation of the choice and ultrasound abdomen or the renal ultrasound. Next, for the liver disease, ultrasound abdomen and the biochemical markers like ALT, AST, GGT, and the bilirubin, which indicate any liver disease, or then if this is due to the viral infection like hepatitis C or B, then serology or a PCR test. So,
In treatments, we could do estrogen levels for PCOS in maybe
in case of
PCOS.
PCOS.
metabolic syndrome, yes, another systemic disease, the metabolic syndrome, then we should assess the reward. But in the case of the metabolic syndromes, there is a hirsutism is very common. Along with there is a acne, hirsutism, and the puffiness of the face, along with there is a infertility type of features. So this is all about the assessment of a puffiness of the face. So the treatment depends upon the diagnosis. Suppose this is a case of a hypothyroidism, then how will you proceed with? See, if this is a patient of the pushing, then we should rule out the cause of the pushing. This is the due to the heterogenic or drug induced, or then this is the adrenal cause, or there is a pituitary related disease. And the third is the CCF. Then we should treat the CCF with the diuretics or with the cardiac issues. And then liver disease, we treat with that diuretics again or a psychosis. So in all of these diseases, the treatment is supportive. There is no confirmatory treatment. Patient has to take the treatment for a long period of time. So this is all about the puffiness report. Thank you.